For me, the decision to become a doctor came out of a few different places in my life. One was a desire to help other people. The other was to be able to use things like science and mathematics and to engage in those topics more deeply. And the final place was to be able to help my own family in understanding the medical problems that they were going through. My main area of interest in medicine is really on preventative care, but also on health education. I think that educating my patients about the conditions that they're experiencing or what they can do in their health care to avoid different conditions is one of the most valuable tools for their health care long term. My philosophy of care for the patients that I interact with is really to provide them with enough information to be able to make good, educated decisions. Ultimately, I'm not the one carrying out the steps that I'm recommending, and the patient that is better informed and understands better their care will do better over time. The most satisfying part of my job is when I can see somebody that really understands what they're doing for their health care, how that's benefiting them, and then gets to actually see the tangible benefits and the tangible improvements that they experience because of it. When someone chooses me as a primary care doctor, I hope that I'm able to provide them both compassionate care, a good listening ear, and then helpful understanding so that they can make the best decisions for themselves. I've spent a lot of time trying to understand the evidence behind the things that I recommend, to understand the risks and the benefits to a variety of medications and procedures and other interventions, so that I can better equip people to make good decisions where they feel confident and comfortable with what they're choosing to do. When I'm not in the medical office, I still really love all areas of science, and so I'm interested in astrophysics and astronomy and new technologies. I also like to be physically active. I like to do the thing that I like to practice what I'm preaching. And one of the areas I like to be active is getting out for running or hiking. But most recently, I have an 8-month-old baby at home, and so he's been taking up a lot of that personal interest time. When patients come to see me, they can expect that they'll always get the same quality of care, attentiveness, and compassion that I give to every single person that I see. Every person should have a primary care physician because you need somebody to help you navigate the world of medicine. A lot of times that physician can be important for helping you solve simple problems, sometimes complex problems, and helping you to prevent things, but also for helping you navigate the language of medicine and the information that you get from specialists and from the hospital and from surgical staff. I think one of the most important things that you can do to improve your overall health is to simply move more. We find that exercise is the key to a lot of different physiologic benefits throughout our bodies: mental health, sleep quality, cardiovascular health, digestive health, and the list just goes on. And I think that making sure that you're incorporating movement as a part of your day, not necessarily formalized exercise even, is vital to being very healthy.